Dr. Aya Abdelaziz, Aya Mohammed, from Mansoura University, Egypt. Role of MRI feature tracking in detecting subclinical myocardial dysfunction in pediatric patients with aortic coarctation.
السلام عليكم. Role of MRI feature tracking in detecting subclinical myocardial dysfunction in pediatric patients with aortic coarctation pre and post correction. Aortic coarctation is one of the most common congenital heart disease. It's defined as a congenital narrowing or constriction of the aorta localized at the insertion of ductus arteriosus to the juxtaductal region of the aortic arch. Cardiac MRI is a preferred advanced imaging modality for non-invasive diagnosis and follow-up of coarctation. In addition to anatomical imaging, functional information also can be acquired with a steady-state free precision. Cardiac MR-based feature tracking is a relatively simple technique analogous to echocardiographic speckle tracking that does not require special imaging acquisition or complex post-processing and can be applied to previously acquired cardiac MR images. Due to the complex 3D architecture of the left ventricular musculature, systolic deformation takes place along several different directions. The evaluation of strain along each of these axes leads to the definition of different types of strain: longitudinal, circumferential, and radial strain. The aim of this work is to investigate the changes in feature tracking MRI in pediatric patients with aortic coarctation in the pre- and post-correction states. This prospective study included 31 patients. They were classified into two groups, pre-correction and post-correction. 7 control cases were included in this study. All patients were referred with echocardiographic diagnosis of aortic coarctation. Patients with contraindication for MRI were excluded from this study. None of our cases had post-correction complications such as pseudoaneurysm dissection or recoarctation. Cardiac MR feature tracking using a tissue tracking module within the CVI-42 software, which was opened for limited time by special permission for scientific research. The endocardial and epicardial borders were manually traced in the end-diastolic phase. Then cardiac MR feature tracking software tracks the border across the whole cardiac cycle. Multiple manual corrections were required in order to achieve good quality tracking. Global longitudinal strain was derived by two long-axis steady-state free precession cine images, while global circumferential and global radial strains were derived from the short-axis SSFP cine images stock. As regards our study, in the pre-correction group, the mean global peak radial and longitudinal strains were significantly compared with the control group, while there was no significant difference between the pre-correction group and controls as regards the circumferential strain. However, there was no significant difference in global peak radial, longitudinal, and circumferential strains between the post-correction and control groups. في مشكلة في
أكبر الصورة من تحت بس يا دكتورة.
ما هو عايز يتظبط بس. تمام معلش بس ثانية واحدة كده. هات لي بس البوينتر وظبطه لي بحيث ان هو يظبط حاجة وما يبقاش عندهم.
مش فاهم حضرتك، يعني هي المشكلة في هي ايه المشكلة؟
Okay, sorry for this interruption. Again, our results. As regards the correlation between the global peak strains and LV mass index, no significant correlation was found between LV mass index and global peak radial, circumferential, or longitudinal strain among cases of the pre-correction group. However, in the post-correction group, there was a statistically significant negative correlation between LV mass index and global peak radial strain. Positive correlation was found between LV mass index and the global peak circumferential strain. There was no correlation between LV mass index and the global longitudinal strain. As a comparison between the studied groups regarding global peak strains, our results show a statistically significant difference between the pre-correction group and stent group regarding global peak radial, circumferential, and longitudinal strains, with higher median value among the stent group. This study adds the following to our understanding of cardiovascular health in patients with coarctation, either pre or post-correction. There is lower mean global peak radial and longitudinal strain in cases of pre-correction group, no significant difference in global peak radial, longitudinal, and circumferential strain between cases in post-correction and control groups. Cardiac MR feature tracking allows quantification of global and segmental LV mechanics and changes with LV hypertrophy long-term after coarctation repair. Case number 1, male patient, aged 8 years, referred with from cardiology department in a children's hospital with echo diagnosed as coarctation. As regard the MRI finding, thinny SFP images show dilated LV with increased LV mass index. Feature tracking MR, the LV endocardial and epicardial contours were manually traced at endodiastole in short axis and long axis. Then the software tracks the features to end systole in long axis and short axis. The strain maps and the super added color maps and the resulting curves in this case shows وقفت عندي. بصي البوينتر رجع لجنبه ومش عارف يجي تاني هنا، مش عارفه في ايه. راح فين؟
Dr. Aya, please try to proceed. No matter if videos don't work, or we apologize for this technical error. I think it happens a lot in cardiac imaging. Always too much videos in the presentations,
Okay.
and sometimes the
Case
software
number
doesn't
2,
work.
male patient aged 15 years, referred with echo diagnosed as coarctation with history of stent implantation. MR finding, the CINI SFP images show average sized LV with normal LV mass index, while the strain maps and the resulting curves show preserved circumferential longitudinal and longitudinal strain. Case number 3, female patient, 2 years, referred with echo, diagnosed as coarctation with history of surgical correction. It shows average size LV with increased mass index, while the strain maps and the resulting strain curves show impaired radial, longitudinal, and circumferential strains. And thank you.
Thank you so much, Dr. Next talk and last talk by Dr. Bassem.